Welcome to SGT Times Explainer. I am Ashutosh. Today we'll discuss what is the cancer scenario in India and what it is going to take to replicate the success in United States. According to a report released last week by the American Cancer Society, cancer deaths in the United States have decreased by 33% since 1991. According to the report, this has resulted in 3.8 million fewer deaths and the success of early detection, lower smoking rates, and advancement in cancer treatment. This trend has yet to be seen in India, where despite advances in therapy, both the incidence and fatality rates of cancer continues to climb. The findings in United States published in CA Cancer Journals for Clinicians states drop of 65% in cervical cancer rates among women in their early 20s between 2012 and 2019, the first cohort to get the human papillomavirus. Cervical and smoking related cancer rates have decreased in India according to doctors. However, the prevalence of lung and breast cancer has risen. Better screening and treatment facilities as well as more complete links between screening centers and hospitals are critical according to specialists. What is the current cancer and death rate in India? According to statistics, an expected 146 lakh new cancer cases were diagnosed in 2022, up from 142 lakhs in 2021 and 13.9 in 2020. The Indian Council of Medical Research's National Cancer Registry revealed in Parliament that cancer deaths climbed to an expected 8.08 lakh in 2022, up from 79 in 2021 and 77 lakhs in 2020. According to the report, the number of freelancers is expected to rise to 157 lakhs by 2025. According to ICMR research based on data from population-based cancer registries, 1 in every 9 Indians will acquire cancer throughout their lifetime. According to the study, 1 in every 68 males will have lung cancer and 1 in every 29 women will develop breast cancer. In 2020, the incidence of cancer among women is 103.6 per 1 lakh compared to 941 in males. The most frequent malignancies in males were lung, mouth, prostate, tongue, stomach cancers. In women, they are breast, cervix, ovary, uterus and lung cancers. Why are some tumors declining? According to Professor G.K. Rath, consultant to the oncology platform Karkinos Healthcare and former chairman of the AIIMS National Cancer Institute in Jhajjar, the incidence of cervical cancer in India has decreased over the previous 50 years from 45 per 1 lakh population to 45 per 1 lakh people. At the same time, there is an increase in breast cancer rates, particularly in urban areas. Rates of cervical cancer have declined due to later marriages, fewer children, better hygiene and vaccination, while the incidence of breast cancer has increased due to the same reasons, including later marriage, having the first child at a later age, not breastfeeding, and a high protein diet, according to Dr. Rath, who also chairs the scientific steering group for the National Cancer Registry. The incidence of breast cancer is 9 per 1 lakh in Barshi, Maharashtra and 45 per 1 lakh in Hyderabad. In the United States, the incidence of breast cancer is 110 cases per 1 lakh people. Unlike cervical cancer, which can be avoided with HPV vaccination, the government expects to launch a campaign shortly. Because the origin of breast cancer is uncertain, there are many particular therapies available. Tobacco-related malignancies such as oral and esophageal cancers are also declining. This is mostly due to cigarette legislation reducing smoking in public setting, Dr. Rath explained. Lung cancers, on the other hand, continue to be a source of worry. Not only smoking causes lung cancer. In Arunachal Pradesh, for example, lung cancer rates are high because people kindle fires indoors throughout the winter. We see lung cancer in Bihar women because they have spent years cooking on chulhas, and with the sort of pollution we are breathing in Delhi, we will see the impact in the next 10 years, said Dr. Abhishek Shankar of Dr. B.R. Ambedkar Institute, Rotary Cancer Hospital at AIIMS. Unfortunately, the survival rate for lung cancer is not very great and it is usually detected in the late stage, Dr. Shankar explained. Have there been any advancements? Yes, Dr. Rath stated that the cure rate for many tumors is increasing and we do see people who have overcome cancer. The cure rate for pancreatic cancer has doubled from 3% 50 years ago to 6%. The cure rate for prostate cancer has increased from 60% to 100%, while the cure rate for breast cancer has increased from 50% to 90% with cheaper treatments. However, to minimize mortality, we must guarantee that patients are detected early and given timely treatment, he stated. Dr. Sushma Bhatnagar, the institute's current director, stated, cancer is no longer associated with death, but much work has to be done. How can we reduce overall mortality? Screening for three most frequent forms of cancer, breast, cervical and oral, must be the primary intervention. It has already begun with the government's newly renovated health and wellness facility. This, together with other government measures, have resulted in individuals arriving at hospitals earlier. It used to have on 80 by 20 rule. 80% of patients arrive at hospital late, of whom 20% are curable, and 20% of patients present early, of whom 80% are curable. Over the previous decade, this has shifted to 70 by 30. Dr. Rath stated that 30% of patients are now arriving at hospitals early. Cervical, breast and oral cancer accounts for 34% of all malignancies in India. Hence, screening is important. However, to achieve mortality improvements, Dr. Shankar believes that treatment must be concentrated. Dual stain testing is the greatest method for screening for cervical cancer, whereas a low dose CT in people with a history of smoking is the best for lung cancer. Breast self-examination cannot be used as a conventional method of screening for breast cancer. To begin demonstrating mortality improvements, we need to refine and better target screening technologies, he added. Furthermore, screening should lead to therapy, according to Dr. Shankar. He said that if you tell a person that he has cancer, but the person doesn't have the means to go to the hospital and get himself treated, the screening will be of no use. There are numerous projects of the government that are working separately and in silos, Dr. Bhatnagar said. This must be coordinated so that after a person is screened, they may be sent to a hospital. We have adopted regions where we assess people and then bring them in for therapy. But this has to happen everywhere, she added. There should be a lot more cancer care centers. For every 5 crore people, we have one comprehensive cancer treatment facility. Surgery is one of the 7 pillars of cancer care prevention. I will discuss only one of the following: chemotherapy, radiation, imaging, laboratory diagnostics and palliation, Dr. Rath added. According to the WHO, developing nations should have one radiation equipment per million people, and thus for our 14 billion people, we need 1400 machines, but we only have 700, he stated. Dr. Rath believes that India has to improve its preparations. Cancer has surpassed heart diseases as the top cause of mortality in the United States. Heart problems remain the major cause in India, although cancer ranks second. When I was studying medicine 60 years ago, people were dying of cholera and cancer was not even in the top 10 causes of death, he remarked. That's all for today in SGT Times Explainer. Thanks for watching.